Hi guys, Dr. Taylor Gray Andrews here with Thrive Physical Therapy in Crowley. One question that I get asked a lot is, what is dry needling and how does it work? One of the theories of what dry needling is doing, why it works, why it helps, is that it's allowing the muscle, tendon, or ligament that we're targeting, it allows it to heal that much more quickly. Dry needling is our most invasive form of treatment. It's the only time that I'm physically, going into the muscles, tendons, or ligaments. Everything else is external. Imagine like if you got a paper cut. Your body is going to send healing properties through the blood to that paper cut to heal it. With the needles, I can create a controlled micro trauma to any muscle, tendon, or ligament that I choose. So not only are we going to flood that area with fresh blood flow that's got fresh oxygen and nutrients in it, but we're also going to flood it with those healing properties. Imagine if you've got a tendon or a ligament or a muscle that's just it's chronic. You've got chronic pain, it's just not wanting to go away. A lot of times it's stuck somewhere in the healing process. So there's 4 phases to the healing process. Chronic issues, they're stuck somewhere in the middle of that healing. It just can't go all the way to that 4th phase of the healing process to be completely healed. With the dry needles, it's almost like we can start it back at square one with that controlled micro trauma that we created. We start it back at square one and it's more easily able to go through all 4 phases of that healing process. It's also going to allow the muscle, if it's a muscle that I'm targeting, it's going to allow that muscle to relax, kind of lose that knot that much more quickly. We can get muscles to loosen up and to increase blood flow externally with, manual therapy, massage, cupping, those kinds of things. But dry needling is just kind of a quicker response, a quicker way to get there. Dr. Taylor Andrews here, going to talk to you guys about dry needling. So let's say we've decided that we want to do it. I've pulled you into the room. If it's an area that is a sensitive area that I need to drape, maybe some of the glute muscles or some of the low back muscles, we'll go into a private treatment room. We'll do some draping. You never have to completely disrobe or anything like that. I can work with just about any type of clothing that you've got on, get to where I want to. I'm always going to use an alcohol wipe and sanitize the area, so it's a nice and sanitary method that we do. So I kind of poke around, leave a little dot with a marker of where I want to go. What I'll do then is I'll insert the needles. This is an example of some of them. Like I was saying, they're very thin and wispy. You might not even be able to quite pick them up here on the video. We would insert the needles, and it just kind of depends on how long I'm going to leave them in for. Sometimes I might leave them in for like 5-10 minutes. Sometimes I might be in there for 15-20 minutes. Just depends on how the patient is tolerating things. Another thing that I might do is set up the stem unit. So it kind of works like jumper cables almost. I can set up these alligator clips here, connect them to the ends of the needles to create an electrical current. What that does is it sends extra blood flow to those muscle groups that we're working on, or those tendons or ligaments. If it's set in a muscle group, it can also get that muscle to pulse a little bit, have that muscle start to contract. And it just allows for a quicker release of those muscles. So I really like, when I can, I really like to use the TENS unit here, so long as the patient can tolerate it. It's going to be a comfortable amount too. With all of what we're talking about here, the needles, the TENS unit, we're always going to make sure that we're setting things up to where they're tolerable. Hi guys, I'm Dr. Taylor Gray Andrews talking about dry needling today. How often should one be doing dry needling? I typically don't do dry needling more than twice a week. I'm usually doing it once or twice a week. One of the things that these needles are doing are they're creating a controlled micro trauma to the muscle, tendon, or ligament that we just targeted. So we want to give that micro trauma time to heal, and that's going to take at least a couple days. Common things to expect afterwards are some muscle soreness. It'll feel sore as if you work that muscle group out really hard. That soreness should resolve in as quickly as a few hours. It might last a day or two at most. Once that soreness resolves though, whatever pain you were having before the needling, that pain should be less intense and less frequent. So you might have to go through some soreness initially, but then after that soreness resolves again, it should feel just that much better. All right guys, so we're talking about dry needling today. A question that I get asked a lot is, maybe you're someone who's interested in it, you want to try it, but you're not sure if your insurance will cover it, you're not sure how much it's going to cost. To that, I'm gonna say call our front desk, call Holly. She's gonna be able to answer those questions for you better than I can. Because it's one of those things that it depends, right? It depends on insurance. If you wanna forego insurance, if you wanna just pay for it cash out of pocket, call Holly and she'll tell you what that cash rate is. But Holly will be able to answer all of those questions for you, so give our office a call.